Ventricular systole marks the precise conversion of intraventricular pressure into effective arterial blood flow. As ventricular contraction continues, the pressure inside the ventricles rises rapidly and soon exceeds the pressure in the aorta and pulmonary trunk. This pressure difference causes the semilunar valves, the aortic and pulmonary valves, to open, marking the beginning of the ventricular ejection phase. Blood is then ejected forcefully from the ventricles into the great arteries. The left ventricle pumps oxygenated blood into the aorta for systemic circulation, while the right ventricle pumps deoxygenated blood into the pulmonary trunk toward the lungs. This phase represents the main pumping action of the heart and is essential for maintaining effective circulation. During ventricular ejection, ventricular volume decreases significantly as blood leaves the chambers. However, a small amount of blood remains in the ventricles after contraction, known as the end systolic volume. The amount of blood ejected during each heartbeat is called the stroke volume, and it plays a crucial role in determining cardiac output. The efficiency of ventricular pumping is measured clinically by the ejection fraction, which reflects the percentage of blood ejected from the ventricles. As ventricular contraction ends, the ventricular muscle begins to relax, causing intraventricular pressure to fall rapidly. When ventricular pressure becomes lower than the pressure in the aorta and pulmonary trunk, blood briefly flows backward toward the ventricles, filling the cusps of the semilunar valves and causing them to close. This produces the second heart sound, S2, and marks the end of ventricular systole. The ventricles then enter isovolumetric relaxation, during which all valves remain closed and ventricular pressure decreases without a change in volume. When ventricular pressure falls below atrial pressure, the atrioventricular valves open, allowing passive filling of the ventricles. This initiates ventricular diastole and prepares the heart for the next cardiac cycle, ensuring continuous and efficient blood circulation.